The way that you know that you're having a long-lasting peel is if there's a healing period. If there's no period of time, like 5 or 7 days or so, where you have scabbiness to the skin, then no matter what the agent was, it means that you haven't had a true peel.
Now, is this painful at all for her?
If the patient were not put under this intravenous sedation, it would be painful.
Because it's acid,
Because yes. Facelifting will correct sagging, but it will not correct the deep lines of the skin.
But 48 hours later, a swollen Sandy wasn't so sure about her decision.
I really was not very clear on what the recovery process would be. But then again, I didn't ask a whole lot of questions.
But the most severe healing process is with a deep phenol peel, which is what Elizabeth is getting. Besides IV sedation, she is hooked up to a heart monitor because...
Phenol could be toxic.
Which is why it's put on at 15-minute intervals.
We've actually just basically killed or destroyed the upper layer of skin. But the good news is when she grows new skin, it'll be thicker, it'll be younger and smoother.
Elizabeth is taped up in a mask to help penetration. 2 days later, she's back to have it removed.
Well, I think I look a little like Frankenstein right now, and I can see by your face you think so, too.
Was it worth it? Let's look at all three before and after. Wendy with a light peel.
I feel a little fresher faced, and when I actually feel the skin, it feels a lot smoother to me.
Sandy's medium peel.
Well, I think you've got to have the right personality and the right nature for it. It's got to mean something to you. I don't think it's for everybody, but I think people like me it's for.
And Elizabeth's deep peel.
It was a bit like having a baby, you know. It's dreadful at the time, but afterwards the results are worth it.
Elizabeth looks 10 years younger after her chemical peel, but this woman will never look the same. She is hideously scarred. Ohio attorney Ned Gold is now getting ready to try her case against the Cleveland doctor who used a technique known as the Obagi peel.
One of the things that was told to her is that there was depth control, that it could be stopped, and unfortunately it didn't stop.
This is what the woman looks like now, even after several corrective surgeries. The type of peel used in her case is named after this man, Beverly Hills dermatologist Zen Obagi, the self-proclaimed king of chemical peels, believed to have performed more than anyone in the world. He's also a master promoter, charging doctors $35,000 to learn his technique, and that rubs some in the field the wrong way.
The magic is it's Dr. Obagi, the magic is he sells it, the magic is he'll train you for the right amount of money. We train people pretty much for free.
Obagi peel is not a scientifically tested peel. Obagi is a marketing scheme. It's a franchise.
Ironically, Obagi claims his is the only scientific peel, that other doctors guess how deep they're going. Obagi takes trifluoroacetic acid, which most doctors use, and adds a formula he argues gives him more control. The problem is, he's never published any scientific studies documenting his claims.
First you do create your science, then you publish.
Well, isn't that experimenting on...
No, that's not experimenting. Actually, I'm doing the same peel everybody else does.
But you just said yours is the only scientific.
Yeah, but see, I'm not doing harm to this patient.
A few minutes later, he had a different answer.
I did not publish because you know what's going to happen with publication? Everybody will read it, then go and do it without training.
Do it without training,
That's
without
right.
paying you.
But Dr. John Demetrician of Vancouver, Canada, went through Obagi's training and no longer uses the technique for this reason. Too many scarred patients.
He teaches to do a very deep peel, therefore you can get some quite dramatic results, but also it's just on the borderline of having complications. So he pushes the peel to the limit.
We spoke with doctors in New York, Miami, Atlanta, New Orleans, and in cities throughout California. This experience is typical.
Unfortunately, I have seen over a dozen patients who have been severely scarred with the Obagi chemical peeling method.
What do you say to doctors who say that they see more scarring with your peel than any others?
I would say they are absolutely wrong. If Obagi has a one complication, everybody have to talk about it. But if someone else had a complication, they don't talk about it, right? So that's not true at all.
Some feel, though, that this price of beauty is just too great to pay.
I see the pain it has caused her, the humiliation it's caused her, and it wasn't worth it.
Just to look prettier.
Just to look prettier.
This is Sarah Wallace for Eyewitness News Magazine.